are new treatments available for cystic fibrosis infections. Imagine living with a condition that causes thick, sticky mucus to clog your lungs and digestive system. That's what people with cystic fibrosis face every day. Because this mucus traps bacteria, infections are common and can be severe. Managing these infections has always been a challenge, but recent advances are changing the game. Let's explore what new treatments are available and how they fit into infection prevention and control. Traditionally, controlling cystic fibrosis infections meant strict hygiene, avoiding contact with others who have the disease, and using antibiotics to treat active infections. These measures help prevent the spread of harmful bacteria and manage symptoms. But they don't address the root cause of the disease itself. That's where recent breakthroughs come in. The biggest leap forward has been the development of drugs called CFTR modulators. These medicines target the faulty protein that causes cystic fibrosis. One of the earliest was ivacaftor, which helps certain mutations work better. But the real breakthrough came with the approval of Trikafta in 2019. This triple therapy works for about 90% of people with cystic fibrosis who have specific genetic mutations. It improves lung function, reduces mucus buildup, and lowers the frequency of lung infections. Many patients report fewer hospital visits and less coughing. Some even see a decrease in the need for lung transplants. Another newer medication called Aliftrek has been approved recently. It offers a once-daily dose and may further improve outcomes, but long-term data is still being collected. While these drugs are transforming care, they are not cures. About 10 to 15% of people with cystic fibrosis do not respond to current CFTR modulators. For them, traditional infection control measures remain as essential. Scientists are also exploring genetic therapies that could someday cure cystic fibrosis. These include gene editing techniques like CRISPR-Cas9, which aim to fix or replace the defective gene. These approaches are still in experimental stages and are not yet available outside clinical trials. If successful, they could potentially eliminate the root cause of the disease, reducing infections and improving quality of life. Even with these advances, infection prevention remains vital. People with cystic fibrosis should continue practicing good hygiene, such as hand washing, and avoid close contact with others who have the disease. Staying current with vaccinations is also important to prevent infections. Regular checkups with a cystic fibrosis care team help tailor treatments and infection control strategies to each person's needs. In summary, new treatments like CFTR modulators have significantly improved the outlook for many with cystic fibrosis by reducing mucus and lowering infection risks. However, they do not replace the need for ongoing infection prevention. Research into genetic therapies offers hope for a future cure, but for now, combining the latest medications with strict infection control remains the best approach. Always consult healthcare professionals for personalized advice, as each person's situation is unique.